Hello, and welcome to everybody to this episode of the Asthma Spotlight podcast. Now, there are a number of tools and applications available for people with asthma, and today I'm delighted to be joined by Dr. Greg Birch, who's going to tell us about the digital health passport and how it's going to be beneficial for people with asthma and allergy. So, hi, Greg. I'm delighted that you agreed to join me today. So would you like to introduce yourself and tell us a bit about the background and an outline of the digital health passport?
Yeah, sure. And thanks, Mark. Thanks for inviting me today. Real pleasure to be here. So my name's Greg Birch. My background's as an A&E doctor. I work as a specialty doctor in the Brighton area. Worked for a long time in East London before coming down here. My role here today is I'm clinical director. I'm actually co-founder as well of a company called Tiny Medical Apps. And we've developed the digital health passport over a number of years. I'll go back then a little bit of the background of the digital health passport. The work started in London. Myself and Matt, who is the Chief Technology Officer, his background's a systems developer. So my background is a clinician within the NHS. We'd been working on our own on developing some apps and some websites. We'd kind of worked around developing a learning game. And we were looking for some funding within the NHS, finding it really struggling, and went out, found some grant funding initially from a group called the Nominate Trust. And what we proposed to them was to build an asthma learning game, to kind of gamify the learning and to base that around an asthma action plan. As we were starting on that, we found out that the NHS in London were looking to commission what it turned out to be the digital health passport. And it was very much aligned with where we've been wanting to take the product. We've been wanting to create a sort of patient-centered health record. We wanted the patients to sort of be in control of the data, be in control of their care plans, and to be a sort of a node really between the different parts of the system to be able to join up primary and secondary care. There's been a lot of challenges really in fitting that data model, but what it led to was us getting commissioned by the NHS in London as part of a wider package of work focused on children's asthma that you're well aware of, Mark, and you were key to that work. And some of the outputs from that piece of work were creating asthma standards for London, creating an asthma toolkit, asthma-friendly schools, and based on the work that you'd done, really coming from the National Review of Asthma Deaths and some of the tragedies which happened in London in those preceding years. This was part of that package of work, to take that forward.
Well, that's interesting. And just to for our listeners, this app is available in the UK and in the whole of Ireland. Is that right?
Yeah, it's right. It's free to download from the app stores. If you search for Digital Health Passport, right. It should pop up in your apps libraries, and you can download and get started right away.
Okay, so tell us a bit about what the app does. What does it provide for people with asthma and allergy?
So, the basic intent of the app is to support people to self-manage. That's the real sort of the crux of it. What we're looking to do is put everything in one place as much as possible, around those areas to support people. So, in terms of sort of some of the features and the benefits of it, it's everybody with asthma, they should have an asthma action plan. They should have a personalised care plan. It's part of what should be delivered to them.
Sure.
We encourage people, if they haven't got one, to get one, to go back and say, where is my plan? And to either get that as a PDF or as a paper plan, in which case they can take a photo and then they can upload that into the app. When people come to the app, we try to, within the first 5 minutes of onboarding, is just to sort of start getting them some value already. So we're kind of looking at elements that should be in an asthma review. So this may be support the asthma review process and get people started on the app. So as we're going through, we're wanting to know, do they know which inhaler they're taking? Do they know that? Is that something they're even aware of? And if not, to find out. And then to watch the correct video. Yeah. Video shouldn't necessarily be the primary way that you learn good inhaler technique. It really should be face-to-face, optimally. And many people will have had face-to-face training, but we know that over time, people start to forget that, exactly how to do things. So these videos produced, on behalf of the Asthma and Lung UK, approved by the UK inhaler group. They're as good as it gets, really, and it's sort of reminding people of the technique. So that's one of the first things. We want, where possible, there's some evidence that people who get regular medication reminders are more likely to take their medications regularly. So we want people to, right in the first stage, is set up medication reminders, to remember to take the preventers twice daily.
How do the reminders work? So if somebody, will the app know if somebody's forgotten to take their inhaler?
No, not at this stage. At this stage, what we're doing is we're just popping up a reminder in the morning. So remember to take your preventer. Another one popping up in the evening, or if they take 4 times a day medication, then on those sorts of times.
Okay.
There is quite a nice roadmap for where we're going with the app, though, which will use the NHS login feature, which is as you use the NHS app. You'll be able to order repeat medications as you can on the NHS app. But we'll go further than that. And as people order the repeat medications, we'll say, okay, this is a twice daily medication. Prompt you to set up a reminder twice daily. It'll say this is an AccuHaler or an EasyHaler. Prompt you to watch the correct video. And then once you've set up those reminders, it'll pop up and say, did you take your medication? Or did you skip it? And potentially, if you skipped it, why? So then we can have a sort of people self-reporting that they track their medication.
Yeah, just on the inhalers, of course, it'll mention all the different kind of inhalers that somebody takes, not just the 2 that you mentioned.
Yeah, no, absolutely. Yeah, there's a wide, and obviously encouraging people to use the spacers as well when that's appropriate.
Right.
Yeah. A large part of the app is really around sort of an education piece. There's 7 sort of key learning messages that we want to repeat and reinforce from what is asthma and why is it important. So, a piece about triggers and avoiding triggers and knowing what to do in an asthma attack, as well as how to take a peak flow and so forth. So we'll take people through a kind of learning journey, is how we see it. So also, you've watched this video, you've done the quiz, now do this one. Yeah. And we'll try to reinforce just the 7 key messages, as well as other information about what to do in hot weather and what to do in poor air quality and so forth. But we'll reinforce that with emails and notifications in the app, trying to bring people back to those key messages. Or if they haven't uploaded a plan, go back to them and say, try to upload your asthma plan.
On the asthma plans, I've had a look at the app and I can see, as you say, people can upload their own plans. Now, what should normally happen is if someone's medication is changed or if they have an asthma attack, the plan should be changed. Now, if someone has a plan that's changed, is it easy for them to upload the new version? Do they have to delete the old one, or how does that work?
Yeah, so it is easy. You just upload the new one. It will store the old one, so you can keep the version history, or you can delete it. But we do think there's value in keeping the old plans. One of the things that we learned when we were building the app was sometimes people had 2 or 3 plans. There was a part of East London where they had a very proactive school nurse service, and it was issuing and correctly changing plans. Plans would get changed by GPs, and plans would get issued when someone went to A&E. Often people didn't know why the plan had changed, and it would revert back to an old version. So I think one of the things is not having sort of one source of truth, and not having a version control, but also understanding why changes were made. And I think as we go forward, we need to, on the plans themselves, record why a change was made to stop people reverting back to previous plans.
So it's probably worth people putting a date on the plan when it is changed.
Yeah. I think there's more work to be done with the plans at the moment as well, because they're not really looking at combination maintenance and reliever therapy plans. They're very much based on the old way of doing things. I think I know you're a big proponent of of changing as many people as possible onto the combination inhalers. I'm not sure really that the plans are quite caught up with that yet.
Yes, I did discuss different options for prescribing controller drugs in a previous podcast. Because as you say, in the UK, we don't have a national plan for using the combination inhalers, the so-called SMART regime, where somebody would use an inhaler for both maintaining their asthma, they take it twice a day, and then the same drug for relief. It'd be nice in the UK if we could get a national plan agreed for using the combination inhalers. Okay, and then I suppose one of the questions I had was really, how does this app differ from other apps that are available? Now, I know your app is one of the few that's been approved by the National Health Service. And are you aware of any other asthma apps that have been approved by the National Health Service?
So the regulatory framework's changing all the time. There was an NHS apps library a couple of years ago, and we put a lot of work in to get approved by that apps library. And we're at the time, the only NHS approved app in that library. The library has since been disbanded, and we rely now on an organisation called ORCHA, ORCHA, which independently reviews apps on behalf of the NHS. We've got the joint highest score there with an ORCHA rating of 88%. So we're very pleased about that. But there are a number of other apps out there, some of which are paid for and some of which have to be commissioned by the NHS. Okay. I think our sort of unique area really was the audience that we chose to work with when developing the app. So we made a conscious effort to co-design the app with teenagers, with children still at school, as well as making sure it worked for adults. So we kind of teenagers got quite high standards, as you know, and so if you can get them happy with the functionality of an app, you're generally going to win with the older populations as well and with their parents. And it's not easy. The first version of the app that we built, and we involved some young people in the design, but soon after we built it, the feedback was it was aimed that they felt the teenagers felt it was aimed at too young an audience. It was too colourful, it was too cartoony, it was too animated, and they wanted something much more conservative and grown up. And we've learned that, using kind of animation and bright primary colours, works for the younger children, and it works for older teenagers, the student groups. They're more than happy again to go back to animations, but the 13 to 16-year-olds definitely want something more conservative, grown up, proper videos, not animation. So.
That's interesting. And have you found any feedback from adults who are using the app useful?
Yeah, I mean, the feedback has been, I don't want to blow our own trumpet too much here, but we've had great feedback from across the profession and from adults as well. When we were doing our initial evaluation, we struggled to recruit teenagers into the first sort of evaluation in East London, Tower Hamlets. And we quickly went to Bart's, to the adult clinics there, to Dr. Pfeffer's clinic there, because the range we were looking at was 13 to 25-year-olds. That was sort of what was labelled young people, children, young people. And from that clinic, we were recruiting people of all ages, actually, not just the 20 to 25. And as I say, once you've got it working for teenagers, you should have a product that works well for adults. And that's been the case.
Are you able to track and see whether people are accessing the app frequently or not? Yeah,
we are. Yeah, so at the moment, I mean, the app is really still in its early stages of going live. So it's actually only, whilst it's available for anyone who downloads it, and I've said that there hasn't been any push or any marketing as yet. We've got somewhere close to 1,100 people now who found the app and started using it. We've done an evaluation or had feedback from 31 people in the Manchester region, which was excellent feedback. Almost a bit too good to be true, but we paid them all a £5 and they self-selected themselves. So they were a group probably who wanted to give good feedback. And what we'll be doing for the NHS areas where we're working with is we'll be able to break down data even to sort of GP level once there's sufficient users, so there's no problems with anonymity. Show how many people have uploaded asthma plans, how many people have watched videos, how many people are tracking their symptoms regularly. And as we go forward, we'll look to provide data back into the system, which is useful to help the asthma for reviews. So, for example, we could connect an asthma control test score, or we can take baseline quality of life scores, which might be useful in research to show how the app is working as an intervention.
I suppose that was one of my questions, really, because the app allows people to enter their peak flow readings as well. Now, does the app record the timing of that entry? So if somebody does a peak flow in the morning or the evening, will it tell when it was done?
It will. Yeah.
And is that available as a report that people can share with their doctors?
So not yet. At the moment, you literally have to bring your phone in, hold it up, and show the graph in the review. Okay. But it's a small step to have that exportable as a PDF, and a small step to have that. The collecting of the patient data and the transferring of it is it's technically relatively simple. The issues you find is when you start sending data into records is more around triage and who's going to look at that data and act upon it. So, as you know, if you see someone's peak flows are tailing right down and you're sending that data in an automated fashion, but no one's acting upon it, we're creating a risk really, because the patient or the family is expecting someone's looking at that data. And if they're not, that's it's introducing a risk really.
Because I suppose that's one of the values of recording information, is to be able to bring it to the attention of a doctor or a nurse, an asthma trained nurse who somebody's seeing. So the question I asked earlier was really, what's unique about this app? What's different compared to the other apps that are available for asthma?
I think the big unique thing for us will be when we introduce the NHS login functionality, because it's connecting people up then to their GP record, and it's putting that in context. It's something you can do with the NHS app, but we're able to go beyond what the NHS app can do in some ways. So not just order repeat medications, but track them and offer the right videos, and do that in the context of an asthma app. There's plenty of other apps out there where you can track your asthma symptoms, where you can link to videos. I'm not sure that they've all been through the same kind of quality co-design, with young people with audience, but there's other good apps out there, for tracking things. There's also lots of other devices which come with good apps as well. So there's Bluetooth ways to track your peak flow, and smart inhalers, and they usually come with an app that gives you a place to store your asthma plan or to track symptoms. There's other things that we have, such as air quality alerts and things like that. So some of the features aren't unique, but it's pulling it into one place. It's connecting up to the NHS infrastructure will be the big step for us.
Okay. And tell me, what have you personally learned from this experience of developing an app? It sounds like a long process, and you really struggled quite hard to get to where you've got to.
So it is a difficult process. So I think it can be summed up really in a little anecdote. We met a chap called David Stables a few years ago, and he was the previous chief exec of a company called EMIS, which is a big GP software company, and he sold it out, I don't know, maybe 10 years ago, and sort of set up a charity and decided to do something different with his life. But we met with him to sort of lay out our plans. This was about 6 years ago, and we laid out our roadmap for the next 2 years and what we were planning to do in those 2 years. And David quite bluntly told us that our plans were at least 10 years worth of work in the NHS. No, it's not 10 years worth of work. This is 18 months development and 6 months filling bits of paper. However, 6 years later, we're still at least 4 years off accomplishing that plan. There's all sorts of challenges, within the NHS. I mean, there's technical challenges, and they change all the time. But most of the challenges really are breaking into the multiple organisations which the NHS is, which all work differently and all want to sign off on their own governance. Understandably, they're responsible. So it's slightly easier now that they come back into the sort of 42 ICSs, kind of more the health board model rather than 140 trusts. And I think the biggest challenge is obviously changing the way people work, and getting people to sort of see that this is a new norm. We think bringing this kind of technology in can kind of raise the level of what we offer as standard care. There's various surveys from Asthma and Lung UK showing that lots of people don't receive what we would consider basic asthma care in the UK, particularly in this age group. So it's not just making sure that people know what basic care they should be getting, but raising that level. And change takes time. I think the one thing I've learned is that everything takes so much longer than you really, really thought it would do.
If I could summarize really, the app's available for people in the United Kingdom and in the whole of Ireland. And it provides a facility for people with asthma and allergy to record their information, their trigger factors, and also provides information for people both in writing and in video format. And there are quizzes as well to check that somebody's understood the information that they've learned. And also you've provided some video information for people. For example, I saw the one on air pollution and what you can do to help to protect yourself. Thank you once again very much, Dr. Greg Birch, for joining me today. And for listeners in the UK and in the island of Ireland, This application, called the Digital Health Passport, is available for download from the App Store. This podcast will be of special interest to people in the United Kingdom and in Ireland, and I will be interviewing inventors of other asthma applications which are available in other parts of the world.